Vice President Mike Pence had what became for him an uncomfortable run-in with Dr. Rob Davidson over the issue of the just announced plan to switch over to block grants for Medicaid. Take a look at what the doctor said to the vice president.
Emergency doctor, I'm worried about the plans they talked about last week of maybe cutting Medicare and then the rollout today of cutting Medicaid. I work in one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is that going to affect my patients?
I haven't heard about cutting some Medicaid.
Cut Medicaid, yeah. The head of CMS announced the plan to let states file for waivers so they could get block grants. So that would essentially cut the amount of money going to the states. Is that a good idea?
Actually, when I was governor of Indiana, we got a waiver from the Obama administration that actually allowed us to expand Medicaid coverage in the states.
Right, but now they're talking about scaling back the Medicaid expansion that we got with the Affordable Care Act, and that 680,000 Michiganders, 600,000 in Iowa. I mean, a lot of people got health care.
We expanded coverage in Indiana.
Right, but I'm just talking about the president and your administration right now, what they're doing. Right now, they're cutting Medicaid.
Those are waivers for states that didn't take expansion.
No, it's for people who took expansion money too. I mean, your administration just announced this. They rolled it out today, and it's going to affect millions of people across the country cutting Medicaid. I mean, is that a good idea or is that a bad idea?
I think you're oversimplifying it.
Well, I think it comes down to that for the people I take care of all the time. I mean, people I see in the emergency department that can't get primary care doctors, once they got Medicaid, they could get primary care doctors. They stayed out of the ER. They actually worked more. They actually contributed to our community more.
That doctor just surgically dismantled him. For a productive conversation, ideally you want something like 100% total understanding split equally between the participants. Mike Pence obviously didn't want to engage with this guy, also didn't seem to know anything about what was actually going on.
Nothing at all.
And in an important issue.
Went back to when I was governor in Indiana, which of course was before he became vice president. So this is an incredibly important issue, and what's also interesting about it is the lead official at the Center for Medicare and Medicaid Services, Seema Verna, it was Mike Pence's healthcare official in Indiana. So, I mean, he does have some sense of what's going on, and this is a consequential issue. You're allowing states to say, give me a fixed amount of money instead of a variable rate depending on how many beneficiaries there are within Medicaid. It is a recipe to cut hundreds of thousands of people potentially off of Medicaid, depending on how many states pick this up. And it gets worse in a downturn, right? Because there's a downturn, people are unemployed, they need health care, and if they have no income, they can go on Medicaid. But in a block granted environment, there's no way. So it's literally worse when the economy gets worse, when people need it the most.
Yeah.
So what I just heard is that next week, the House Democrats are going to vote on what is called a resolution of disapproval for this proposal. And what that means is that there's something, it's called the Congressional Reform Act, and Trump's Republicans did this earlier in his term, in the first part of the term. You can vote as a Congress to disapprove of a resolution, and then they can't do it. And it's a up or down, and they have to vote on it. So once this gets through the House, and I believe it will, it has to go to the Senate, and all those senators like Susan Collins and Cory Gardner and Tom Tillis and all those guys will have to vote on whether to cut Medicaid. And I truly believe you'll see more ads during the general election on this than you will on impeachment.
Well, that certainly makes sense. My question would then be, like, ideally, you'd want to live in a country where a political party having as their standing goal, we want to cut as much of the spending on the poor as possible, that they wouldn't do it. We don't live in that country, but so they still will cut it, but they will hide it as it's a restructuring. It's a different way of funding it. Will they be able to communicate this as the cut that it is with the I would say Democrats who might be making campaign ads about it, when it has the camouflage of structural change of funding, block grants as opposed to sliding scale, all that?
Who's saying it, I guess, because I mean they're saying it that way, but then there has to be a cohesive argument. And the hard part is coming with an intelligent argument to keep blocking down bad arguments that are based in in lies, number one, and also emotion. Be like, these Democrats are coming after you. They're going to do this. They're going to do that. And then it paints this picture of people that are evil trying to get you when they're actually right in front of you doing exactly that. So again, this happened in 2017 and with the famous John McCain vote. They were trying this as part of the rejection of Obamacare in the first place. This was in the tenets of their appeal to voters. Be like, hey, we're trying to get rid of this and have block grants. They've been pushing this for a while. So now after the devastating vote that solidified and galvanized Trump's disdain for John McCain right before he passed away, they're like, oh, we can try it again now. Yeah. Oh, he's gone. Let's go ahead and go for it again with another mask. So you're gonna subvert exactly what Congress and the Senate voted on and try and do it all over again, just specifically with this one because you just feel like it.
I think you ask how are Democrats going to message this? They should hire Dr. Rob Davidson. That guy.
That's pretty effective.
It was extremely effective because he didn't buy all the, he said, this is just going to cut Medicaid. This is functionally a cut. It's going to cut it for thousands of people who need this in my community. And that's the way to bring it home is to just go there.
Yeah. You can cut that ad again right now. Play that
absolutely
part of Pence saying, well, in Indiana I did this way, in Indiana I did this way, in Indiana I did it this way, and then ask the voiceover lady from the Lincoln Project commercials, hey Mike, what changed your mind now? Is it Trump? I mean, it's too easy. Anytime that you used to be a certain way, now you're a different way, strictly because of your position. That's exactly what we're looking for to find out your lack of principles.
They couch this in reform, they couch it in restructuring and all, but all you have to say is they're going to end Medicaid as we know it.
Yep, exactly.
And Democrats sometimes are pretty good at that. They can fearmonger around Medicare, Medicaid, and Social Security. They know how to do that.
Yes.
And I think Sanders knows how to do that pretty well.
Better than some of the other frontrunners, certainly, who have themselves threatened those things. Allegedly, I know it's up in the media really hasn't looked into it, so who can say? And bear in mind, so you referenced the thumbs up, thumbs down. For all of the terrible things that Donald Trump has done, the ridiculous statements, looking laughable on the international stage, his worst approval rating was when the Republican Party in that first year were actually trying to get things done, but all of it was horrendous. That was when he was at his worst. And now, gearing up for his re-election bid, we have a video on the Dayen Report we recorded this morning. Me and Brett are like, it's 10 ways Trump could win in 2020. I don't think he's gonna pay attention to it because his strategy so far is announcing he's gonna look to cut Social Security. They're already trying to cut Medicare and Medicaid after years of stopping its expansion. They've activated challenge mode for this re-election by doing all of the things you're not supposed to do. It is going to be up to the media to be honest about what they're doing and the Democrats to rightfully point it out because there's nothing more damaging than their persistent campaign of going after the most vulnerable. Now, really fast, I just want to run through a couple of graphics for people, especially outside of the country, who don't necessarily understand what is happening in this reformation of the funding. So bear with me for just a minute. Currently, Medicaid covers healthcare for 71 million people across the country. This is not a small program, it is absolutely massive. Most are low-income people, disabled people, and children. It's set up as a federal-state partnership. A state contributes money to cover its Medicaid population, and the federal government matches that contribution using a formula based on a state's per capita income. Therefore, low-income states get more from the federal government than high-income states do. There's currently no limit to what federal government contributes. Medicaid beneficiaries across the country have a right to whatever care they need for however long they need it, even, as you pointed out, in a downturn where you might have more people on it suddenly. You're not talking about them just divvying up X dollars between more people. You get actually more funding because you have more need for it. With this announcement, CMS is inviting states to design Medicaid plans that work with a new capped funding approach. They have flexibility in how they design these plans and could be exempted from certain Medicaid requirements. For example, the plan would allow states to create a formulary to pick and choose which drugs are covered. Normally, Medicaid covers all drugs. So under the new system, you're gonna wanna be very careful about which illnesses you have. Choose wisely, because you might not be able to get certain types of medication in the future. One thing I'm interested in, I'd love to hear your read on this, is block grants could run into trouble in the courts, just as Medicaid work requirements already have, if judges find they are contrary to the purpose of the Medicaid program, which is, of course, actually provide those benefits. Do you think that's likely to happen?
I think you'll almost certainly see an attempt on the part of advocates for patients and progressive groups to try to block it in the courts. I would say two things. So this puts the onus on the states to design a new program. We know what states are going to do that. California is not going to set up a block grant program. This is going to be conservative states, again, widening the divide. Some of them don't have Medicaid expansion at all, and now they're going to target it so that it's a block grant and even fewer people can become eligible. So this is just going to widen that divide.
Yeah.
The second thing is we already know what this looks like. This is what they did with welfare. So welfare, after the Clinton reform law, became a block grant program. And for the first 5 years, it was working fine because there was a huge surplus, and this was one of the better times economically in recent memory. And everyone said, oh, see, welfare reform worked great. And then the dot-com bubble popped, and then 9/11 happened, and there was this big downturn, and a lot of people were out of work, and suddenly they realized that welfare wasn't there as a safety net support. And then the Great Recession happened, and then we really understood that nobody was able to get these benefits. And so I think we already have the model for what this looks like, and it's really, really not good.
That's what I was, the welfare and SNAP program thing is exactly what I was thinking about, because also, the way this will also be posed, like it starts by, hey, you know, because they have exclusions for a certain elderly, certain sicknesses, all that thing. And that's supposed to be something where their compassion comes into play. When in reality, what it'll happen, it'll continue to get progressed the way that welfare has. It started as you said, oh, we reformed it and it's so great now. But as you keep on pushing and cutting and cutting and pushing and cutting, it keeps getting shaved down. And the way that people are portrayed that are having to depend on this is lazy. How do you go for your entitlements? You're siphoning off of people who are successful, go get a job.
Right.
Part of it is work requirements. So it'll be treated the exact same way. When people are embarrassed to mention that they ever were on any kind of welfare because you're gonna be shamed for it. You un-American, lazy POS. That's the way we see them. And this is gonna be another program. They're trying to make another program that's seen exactly the same way. Now, you mentioned some of the states, like Tennessee was specifically one of the states. I remember reading this article.
Right.
One of the states that said, hey, we wanna go with this too, but they weren't even eligible for it because they didn't even accept the Medicaid, the Obamacare expansions in the first place.
Yeah.
Any kind of way, and that's just an example of any kind of way for certain states to continue to constrict any kind of help for their citizens. If it's not a simple campaign ad to say, hey, Tennessee, your state hates you. Which one is it gonna be like? But there's somehow they find a support of the people in their state enough to back up things that hurt them the most. And ironically, you mentioned California won't be the one to do it, but those libs in California and the coastal progressives are trying to destroy the country. The people in Tennessee are voting to destroy themselves and they don't even know it. Those are the people who are gonna get affected first and foremost by these types of policies.
Yeah, you know, like they always say, like if a state has high taxes or they're raising their taxes, like, oh, people gonna flee, people gonna flee. They don't say the same thing about like, what if we change all of our programs to absolutely screw over people who desperately need medical care?
Right.
For some reason, they're not afraid of their populations fleeing for states that actually care about whether their people live or die.
Hey, and remember, when was the last time you guys moved? Doesn't matter when. Everybody's moved at some point in their life. It's not a $5 expense.
Yeah,
especially moving out of state. So when they say, hey, you know, we got states across, we got state right next to you that you can easily go to and find your services. Oh yeah, just move there, leave my job that you said I should keep, and my kids' school, anything like that. It's just a simple move. Just jump in your Corolla and go.
And in fact, in aggregate, mobility of that nature is at near record lows in the United States.
It's hard.
Really fast, I saw that there were some member comments about this story, so I wanted to read them. Jenk's Instagram Fefe said, and I can't believe that I forgot this. Says, I voted for Dr. Rob in 2018. He was a Justice Democrat. Unfortunately,
really?
my district is big trouble. I can't believe that I didn't recognize the name.
I didn't know.
Salty Veins says, come on, John. If we're only going to be saved by the media actually doing its job and Dems handling effective messaging, we're doomed. I am right there with you. But you know, if you were going to choose one candidate who could point to a career of protecting Social Security, Medicare, and Medicaid as a priority,
it'd be Joe
obviously,
Biden.
Yeah. I think you mean Klobuchar. And then by the way, I'm gonna read this mainly because of the name. It's taking Janky U's bet all day long. I think Brett's gonna like that. Oh wow, a resolution of disapproval. That sounds like the equivalent of a strongly worded letter. Yeah,
but it isn't. I mean, it actually would eliminate the regulation if it passed both houses.
Yeah.
And of course was signed by the president.
Exactly.
Don't miss your chance to win a trip to Los Angeles and have dinner with Cenk, Anna, and me. Just head to tyt.com/dinner in LA to register to win. Sign up for a free Aspiration Spend and Save account, register your eligibility, swipe your Aspiration card on daily purchases to gain entries to win a chance to fly to LA and have dinner with the TYT hosts. Not only are you entering to win that dinner in LA with Jank and Anna and myself, but you're also able to deposit your hard-earned money without it going towards fossil fuel exploration or production. And as a friendly reminder, even if you already have an Aspiration account, you must still first register to be eligible for the sweepstakes.